Hello everyone, my name's Amy Duff and I am a nursing student at Indiana State University, currently in their LPN to BSN program. The presentation I have for you today is a project that I've created for my community health nursing class. Due to COVID restrictions, there's not as much face-to-face clinical time, so our presentation is to hopefully help provide some community education in the time where we're lacking face-to-face interactions with people. So today my topic is diabetes. You've probably heard this word before, heard of diabetes. There are a few types of diabetes, but today I'm going to focus on type 2 diabetes mellitus. So let's start off here with a quiz, a little pretest to see what you might already know. First question, true or false? Type 2 diabetes only occurs during pregnancy. Second question, also true or false? Being of Hispanic origin increases your risk for type 2 diabetes. Next, answers. If you answered false on number 1, you're correct. Diabetes that occurs during pregnancy is called gestational diabetes, and as you'll learn later on, that can put you at increased risk of developing type 2 diabetes. However, type 2 diabetes can really affect anybody. And then also, if you answered true to number 2, being of Hispanic origin does increase your risk for developing type 2 diabetes. So let's go learn a little bit more about diabetes. First, what is diabetes? Well, this is a condition where your body produces little to no insulin. Insulin is a hormone released by a pancreas in response to sugar in your blood. So when you consume food, most of that food gets broken down into glucose, which is a sugar, and it needs to get into your cells to fuel your cells, give you energy. And the insulin released in response to the sugar in your blood, it acts as sort of a key, unlocking your cells and then allowing your the sugar in the blood to gain access to the inside of your cells, gives you energy and fuels your body. So when you don't have this insulin released into the blood, you sort of have thrown away the key for the sugar to get into your cells. So this health problem can lead to serious complications, and there's no cure. However, it's preventable and it can be very well managed. So people do live with diabetes, and there are many things that you can do to either prevent or really improve the outcome. Next, my objectives for you. First of all, in this module, I want you to be able to identify your type 2 diabetes risk factors. Some of these are considered modifiable, such as your body weight. Some of these are considered non-modifiable, such as your age. Next, I want you to identify potential signs and symptoms of type 2 diabetes. Things you should be looking for that might lead to a diabetes diagnosis. Also, I want you to know first and foremost what you can do to prevent type 2 diabetes. As I said, there's no cure, but this is something that is preventable. And lastly, if you are diagnosed with type 2 diabetes, I want to give you some tips on how to manage and live with type 2 diabetes. So, on to some statistics. My focus here are people, adults, living in the United States. First of all, there are 34.2 million adults in the United States who have diabetes, and it's the 7th leading cause of death. Number 1 cause of blindness, kidney failure, lower limb amputations in adults. And I mentioned before, those serious complications all arise from your blood sugar being too high, not being able to get into your cells. And lastly, cases have doubled over the past 20 years. And it's one of those things where this is preventable, so let's see what we can do to prevent it from happening. So here's the risk factors, as I brought up earlier. Some of those things we call modifiable, such as obesity, your body weight. You have control over that. Your age, however, is non-modifiable. That's just a part of life. Family history is another risk factor. If you have parents or sister or brother, grandparents, that puts you at a higher risk. Inactive lifestyle, being of Hispanic, African American, American Indian, or Alaska Native, those are all things that are non-modifiable that put you at a higher risk. Fatty liver disease or a history of gestational diabetes, as I mentioned earlier when you answer the first question, is a history of having diabetes while you're pregnant does increase your risk of later being diagnosed for type 2 diabetes. Next, I want you to know signs and symptoms. So you may not have any of these, or you may have all of these, and certainly having any combination of these, or one or two, whatever it may be, doesn't necessarily mean that you have type 2 diabetes. If you're experiencing anything like this, you should seek care from your primary care physician or healthcare provider. So weight loss, and especially unintended weight loss, if you're not trying to lose weight and it's happening, that's an indicator. Increased hunger, if you're excessively tired, if you have any wounds that are not healing well, increased infections, thirst, increased thirst, blurred vision, or numbness. So like I said, any of these, and could be all of them or one or two of them. It's always worth letting your doctor know what's going on so you can be screened. Next, prevention. I said, again, it's not a curable disease. However, it's a preventable disease. So, the biggest things are lifestyle modifications, making sure you're eating a healthy diet, getting plenty of exercise. That doesn't mean you need to sign up for the next marathon that comes through town. However, just getting regular exercise, finding things that you enjoy doing, there's a higher likelihood you're going to stick with it. So, some people like riding a bike and some people like taking long walks. Whatever it is, it's good to just find something you enjoy, so you'll stay with it. Managing stress. I don't think people realize really how stress can impact your body and the chemical changes. If you do have diabetes, you are diagnosed with diabetes, the biggest thing of managing your blood sugar, going to your regular checkups and preparing for emergencies. What happens if your blood sugar is too high or too low? Making sure you're taking your medications, making sure you're prepared for anything that might arise, because these can turn into some serious emergencies, and you need to be prepared for that. So with that said, let's take a little quiz here to end the presentation. Number one question is, what best describes type 2 diabetes? A blood infection, liver disease, disorder caused by too much exercise, or a condition of high blood sugar? Question two, what is a risk factor for type 2 diabetes? Healthy body weight, age greater than 45, no family history of diabetes, or cigarette smoking? And last question, true or false, diabetes can be cured. The answer, if you answered D for one, you are correct. That is a condition of high blood sugar. If B, number two, was it age, 45 or older is a risk factor. And question three is false. Diabetes cannot be cured, but it is preventable. So hopefully you've learned a little something. And with that said, I'm going to give you a few resources for diabetes prevention and management. The information and statistics I provided you with today came from the Center for Disease Control and Prevention, the CDC. Here's a website, and You're welcome to visit that. Also, the American Diabetes Association, information on diet and exercise right here, some links that you can go to. Like I said, the information provided to you today was from the CDC site on diabetes.